I'm Cassie Sanchez with the Sanchez Insurance Group, and I'm my friend Brenda Ridgely from Impact Health Sharing today to talk about all the good work that she's doing. Can you give us a few tips for our listeners and watchers out there that might be shopping around for health insurance plans and just maybe even touch briefly what's the difference between a health sharing versus like a health insurance program?
Okay, well, first, my tip is, and I was guilty of this too, as an entrepreneur. Health insurance was kind of like the last thing that I wanted to dig into each open enrollment, and
It's expensive.
it's expensive. Didn't want to read all the documents and get all the fine print. Just set me up with something that's going to help me, I hope, and but so I encourage people to do a little investigating and be open to new ideas. Health sharing is kind of it's not a super new concept. It's been around for decades. And gosh, today I think I saw a number. It is a significant number of folks that are dollars that go towards health sharing programs versus insurance. But people get nervous when it comes to their health care, and they go, oh, what's this all about? I don't know. I think maybe I better just stick with paying double because I know what I've got here. But just do your due diligence and be a little open-minded to learn a little bit about some new ways of doing things, because it's just progress. So that's kind of my advice, is just to do some comparison and really see what you have your hands on. And the difference between health insurance and health sharing is significant. So insurance is a contract between a provider and an individual, a policyholder, with a for-profit insurance company. So you contract and pay kind of expensive insurance premiums most of the time, from my experience anyway, in exchange for their promise to pay your medical bills. Well, health sharing is different. It's in that it's voluntary. It's a not-for-profit system where millions of Americans come together through technology to share each other's medical bills. There's no contract and there's no guarantee or promise to pay. However, it works very much like insurance. And it was in the early 80s when Americans began to turn to health sharing as an alternative to kind of combat these high prices. And here's that number I was looking for. Today, it's grown into an industry that shares approximately $3 billion per year.
So I'm going to pick on Brenda a little bit because before we started recording this video, she had also mentioned some of the numbers, just the cost alone. And I thought that was pretty important for people to know about. So let's take a family of four, 2 parents and 2 kids on the open market, that the health insurance plan, how much might that actually cost somebody, rough estimate?
Yeah, in health insurance?
Mm-hmm.
Well, I can only give my example. My husband and I are both entrepreneurs, and we work for ourselves, and we had to provide our own coverage with Obamacare. And for my family of 4, for a while we had some tax credits that helped out, but by the end of it, in the most recent years, we were spending $1,600 a month for our family of 4, and our deductibles were $6,000 per person, with a family max of about between $16,000 and $17,000. That's a game changer financially. I mean, like a mortgage payment for some. It's significant. It's hard to be in business, and even if you're insuring yourselves as independent business owners, imagine trying to cover, have a few employees and help them. So with health sharing, we transitioned to it, and again, my family of 4, we're currently paying under $550 a month, and our family deductible is $2,500.
It's huge.
It's huge.
Huge difference.
Yeah. So as far as cost goes, the monthly cost is basically based on the oldest person in the household, and then the number of people that are in the household, up to 3 additional. Anything over 3 is doesn't count, so it's all included. And then you get to select your primary responsibility amount, which is kind of like a deductible, not the same, but it acts like that. So dramatic savings over ACA plans like Obamacare, and much greater value for the most part. Prices start at about $65 a month for individuals, and start at $330 a month for families.
Well, thank you, Brenda, with Impact Health Sharing. Hopefully this has been an educational video. Feel free to submit questions below, and we'll make sure Brenda gets those answered for you if you respond on the Sanchez Insurance Group. We'll share it on her Facebook. Check it out. She's got some really exciting things out there to help people save money on their health insurance or health health carrier health plans. There we go.
Thank you, Cassie, so much for the opportunity.